Did you know that some fruits, while healthy for most, can be dangerous for seniors? Stay tuned to protect your health and longevity. We've all been told to eat more fruits for better health. But what if I told you that 8 common fruits could secretly sabotage your longevity? For seniors, the wrong choices might trigger blood sugar spikes, medication conflicts, or even organ damage. Here's the kicker. The last fruit on our list is the most critical to avoid. It's not just risky, it's a silent threat hiding in plain sight. If you or a loved one takes certain medications, you'll want to watch until the very end. Today, we'll reveal the 8 fruits seniors must avoid, backed by medical insights. But before we dive in, this video is for informational purposes only. Always consult your doctor for personalized advice. Number 1, grapes. Grapes, often celebrated for their rich antioxidants and nutritional benefits, can pose significant risks for seniors due to their high sugar content, potential choking hazard, and potassium levels. While they are a delicious and convenient snack, it's essential to understand why they might not be the best choice for older adults. Grapes contain natural sugars, primarily glucose and fructose, which are rapidly absorbed by the body. A single cup of grapes has approximately 23 grams of sugar, making them a high-sugar fruit. Despite having a low to moderate glycemic index, GI, overconsumption of grapes can lead to blood sugar spikes, especially in seniors with diabetes or insulin resistance. While small portions may not drastically affect blood glucose levels, eating too many grapes can overwhelm the body's ability to regulate sugar effectively, complicating diabetes management and increasing the risk of hyperglycemia. The smooth texture and size of whole grapes make them a serious choking hazard, particularly for seniors with swallowing difficulties, dysphagia, which is common in aging populations. Grapes can form a tight seal in the airway due to their soft yet firm structure, making them difficult to dislodge without specialized intervention. This risk is heightened for individuals with weakened chewing abilities or those who are easily distracted while eating. To reduce this danger, grapes should always be cut into smaller pieces before consumption. For seniors with kidney disease or impaired kidney function, the potassium content in grapes can be problematic. Grapes contain about 6% of the daily recommended value of potassium per cup. While potassium is essential for heart and muscle function, individuals with chronic kidney disease, CKD, may struggle to filter excess potassium from their blood. This can lead to hyperkalemia, a condition characterized by dangerously high potassium levels, which may cause symptoms like heart palpitations, muscle weakness, or even life-threatening complications if untreated. For these individuals, even moderate consumption of grapes could exacerbate their condition. Number 2, oranges. Oranges, while rich in vitamin C and antioxidants, pose specific risks for seniors due to their high acidity and potential interactions with medications. Oranges are highly acidic, with a pH level that can erode tooth enamel and worsen acid reflux. Their acidity does not increase stomach acid production, but can directly irritate the esophagus, exacerbating symptoms of gastroesophageal reflux disease, GERD, like heartburn and chest pain. For seniors with weakened digestive systems or pre-existing GERD, consuming oranges may trigger discomfort or vomiting. Additionally, the acidity in oranges can damage tooth enamel over time. Enamel erosion exposes the softer dentin layer, leading to sensitivity, decay, and discoloration. Seniors with existing dental issues or those who consume oranges frequently may face heightened risks. Oranges and their juice can interfere with certain medications, particularly those metabolized by enzymes in the liver. For example, statins and blood pressure drugs. While grapefruit is more commonly associated with statin interactions, some citrus varieties, for example Seville oranges, may also affect drug absorption, potentially increasing side effects. Alendronate, Fosamax. Orange juice can reduce the absorption of this osteoporosis medication. Patients are advised to take alendronate on an empty stomach and wait at least 2 hours before consuming orange juice. Fexofenadine, Allegra. Orange juice may decrease the effectiveness of this antihistamine by altering its absorption. Quinolone antibiotics. Calcium-fortified orange juice can reduce the efficacy of antibiotics like ciprofloxacin, though non-fortified juice is less likely to cause issues. Potassium content. While oranges are not as potassium-rich as bananas, excessive consumption, for example, multiple oranges daily, could strain kidneys in seniors with kidney disease. Fiber overload. A large orange contains 4.4 grams of fiber. Eating multiple oranges in one day may cause bloating, diarrhea, or stomach cramps in those unaccustomed to high fiber intake. Number 3. Watermelon. Watermelon is a beloved fruit known for its refreshing taste and high water content, making it a popular choice, especially in warmer months. While it offers numerous health benefits, such as being rich in vitamins A and C and the antioxidant lycopene, it can pose specific risks for seniors due to its glycemic properties and potassium content. Watermelon has a high glycemic index, or GI, typically ranging from 72 to 80, which means it can cause blood sugar levels to rise quickly after consumption. For seniors, particularly those with diabetes or prediabetes, this rapid spike in blood sugar can be problematic. However, it's important to note that despite its high GI, watermelon has a relatively low glycemic load, GL, when consumed in moderate portions due to its high water content and low carbohydrate density. For example, a standard serving size of 120 grams, about 2 thin slices, has a GL of just 5 to 6, which is considered low. The concern arises when watermelon is consumed in large quantities or as juice, which lacks the fiber and bulk that helps slow sugar absorption. Overeating watermelon can significantly increase its glycemic load, leading to blood sugar spikes that may strain the body's ability to maintain stable glucose levels. Seniors with diabetes should pair watermelon with foods high in fiber, protein, or healthy fats, such as nuts or seeds, to slow sugar absorption and mitigate these effects. Watermelon is also a source of potassium, an essential mineral that supports heart health and muscle function. However, for seniors with kidney disease or heart conditions requiring potassium regulation, even moderate amounts of watermelon can pose a risk. A single cup of diced watermelon contains approximately 170 milligrams of potassium. While this may seem low compared to other fruits like bananas, excessive consumption can lead to hyperkalemia, elevated potassium levels, which can cause symptoms such as irregular heart rhythms, muscle weakness, or even life-threatening complications. For individuals with chronic kidney disease, CKD, the kidneys may struggle to filter out excess potassium effectively. This makes even small amounts of potassium-rich foods potentially harmful. Seniors with heart conditions who are on medications like ACE inhibitors or potassium-sparing diuretics should also be cautious, as these drugs can further elevate potassium levels when combined with dietary intake from fruits like watermelon. Number 4. Avocado. Avocados are often praised for their nutrient-dense profile, including heart-healthy fats, fiber, and vitamins. However, their high fat content and potential interactions with medications require careful consideration for seniors, particularly those managing weight or blood pressure. Avocados are predominantly composed of monounsaturated fats, 77% of their calories, which are linked to improved heart health and cholesterol levels. While these fats are considered healthy, their calorie density, 160 calories per 100 grams, can contribute to weight gain if consumed excessively. For seniors, this is especially relevant due to age-related metabolic slowdowns and reduced physical activity. However, research suggests avocados may support weight management when consumed mindfully. Their high fiber content, 7 grams per 100 grams, and healthy fats promote satiety, reducing the likelihood of overeating. Studies show that substituting avocados for other fats in calorie-restricted diets does not hinder weight loss and may even improve lipid profiles. 5. For example, a trial found that adults who ate one avocado daily for 12 weeks experienced reduced abdominal fat compared to those who did not. The key is moderation. Seniors should balance avocado intake with other nutrient-dense foods to avoid excessive calorie intake. Pairing avocado with fiber-rich vegetables or lean proteins can enhance its weight management benefits. While avocados are not directly linked to blood pressure medication interactions, their high potassium content, 10% daily value per 100 grams, may pose risks for seniors with kidney disease or those taking potassium-sparing diuretics, e.g. spironolactone. Excess potassium can lead to hyperkalemia, a condition that may cause irregular heart rhythms or muscle weakness. Additionally, avocado's healthy fats may indirectly affect blood pressure by improving cardiovascular health. Studies indicate that monounsaturated fats can lower LDL cholesterol and reduce inflammation, both of which support heart function. However, seniors on medications like ACE inhibitors or beta blockers should monitor their potassium intake and consult their healthcare provider to ensure safe consumption. Number 5. Papaya. Papaya is a tropical fruit celebrated for its digestive benefits and rich nutrient profile, including vitamin C, vitamin A, and antioxidants. However, for seniors, papaya can pose certain risks due to its enzyme content and high fiber levels, particularly when consumed in excess or alongside specific medications. Papaya contains an enzyme called papain, which helps break down proteins and aids digestion. While beneficial for some, papain can interfere with certain medications, making papaya a risky choice for seniors on specific treatments. Blood thinners, for example, warfarin. Papain may enhance the effects of blood-thinning medications like warfarin, increasing the risk of bruising and excessive bleeding. Seniors taking these medications should monitor their blood clotting levels, for example INR, regularly if they consume papaya or papaya-based supplements. Diabetes medications. Papaya can lower blood sugar levels. When combined with anti-diabetic drugs, this effect may lead to hypoglycemia, dangerously low blood sugar levels, which can cause dizziness, confusion, or fainting. Thyroid medications, for example levothyroxine. Consuming large amounts of papaya may reduce the effectiveness of thyroid medications like levothyroxine, potentially disrupting thyroid hormone levels. Heart medications, for example amiodarone. Papaya may increase the concentration of amiodarone in the body, heightening the risk of side effects such as dizziness or irregular heart rhythms. Seniors taking any of these medications should consult their healthcare provider before incorporating papaya into their diet. Papaya is also rich in dietary fiber, with one medium fruit providing about 3 grams of fiber. While fiber is essential for digestive health, excessive consumption can cause discomfort in sensitive individuals or those with slower digestive systems. Bloating and gas. The high fiber content in papaya can lead to bloating or gas, especially in seniors unaccustomed to a fiber-rich diet. This is particularly true when consumed alongside other high-fiber foods. Diarrhea or cramping. For individuals with irritable bowel syndrome, IBS, or other gastrointestinal sensitivities, the fiber and enzymes in papaya may overstimulate digestion, resulting in diarrhea or abdominal cramps. Unripe papaya risks. Unripe papayas contain higher concentrations of papain and latex-like compounds that may irritate the stomach lining or esophagus, potentially causing ulcers or worsening acid reflux symptoms. Number 6. Star fruit. Star fruit, also known as carambola, is a tropical fruit admired for its unique flavor and star-shaped appearance. However, beneath its appealing exterior lies a significant health risk, particularly for seniors with kidney disease or compromised kidney function. The presence of a potent neurotoxin and high oxalate levels makes starfruit a potentially dangerous choice for certain individuals. Starfruit contains a neurotoxin called caramboxin, which is normally filtered out by healthy kidneys. However, for individuals with chronic kidney disease, CKD, or impaired renal function, the toxin cannot be effectively excreted and begins to accumulate in the bloodstream. This accumulation allows caramboxin to cross the blood-brain barrier, leading to severe neurological effects. Symptoms of starfruit neurotoxicity in those with CKD include persistent hiccups, vomiting, confusion, and psychomotor agitation. More severe cases can escalate to seizures, coma, and even death within hours or days of consumption. Research has shown that consuming as little as half a starfruit can trigger these symptoms in individuals with compromised kidney function. In Brazil, where starfruit is popular, public health laws mandate warnings about its dangers for patients with CKD. Even individuals with normal kidney function are not entirely exempt from risk. While they can typically tolerate higher amounts of starfruit, up to 15 fruits, excessive consumption may still lead to kidney damage due to oxalate nephropathy, a condition where oxalates in the fruit cause kidney stones or acute kidney injury. The neurotoxin caramboxin disrupts the central nervous system by interfering with the GABAergic system, which plays a critical role in calming neural activity. This disruption can result in symptoms such as dizziness, confusion, and agitation. In extreme cases, prolonged exposure to the toxin can cause irreversible brain damage. For seniors who may already experience age-related cognitive decline or neurological conditions like dementia, consuming starfruit could exacerbate these issues or mimic symptoms of more serious conditions. As such, avoiding starfruit is particularly important for older adults who are more vulnerable to these effects. Number 7, dried fruits. Dried fruits, such as raisins, dates, prunes, and apricots, are nutrient-dense and convenient snacks that offer fiber, vitamins, and antioxidants. However, their concentrated sugar content and sticky texture can pose specific risks for seniors, particularly those managing diabetes or dental health concerns. The drying process removes water from fruits, leaving behind a smaller, energy-dense form packed with natural sugars like glucose and fructose. For example, raisins contain 59% sugar, dates contain 64 to 66% sugar. Other dried fruits like apricots and figs also have sugar levels exceeding 50%. This concentration of sugar can lead to rapid spikes in blood glucose levels when consumed in large portions, especially for seniors with diabetes or insulin resistance. Unlike fresh fruits, which contain water to dilute their sugar content and fiber to slow absorption, dried fruits deliver a potent dose of carbohydrates in a small serving. For instance, just 1 ounce of raisins contains 84 calories, almost entirely from sugar. While dried fruits do retain fiber, which can help stabilize blood sugar levels when eaten in moderation, excessive consumption undermines this benefit. Seniors should limit their intake to small portions, for example, a quarter cup, and pair dried fruits with foods rich in protein or healthy fats, such as nuts, to slow digestion and reduce glycemic impact. The sticky texture of dried fruits makes them cling to teeth, creating an environment conducive to bacterial growth. This is especially problematic for seniors who may already face age-related dental issues, such as weakened enamel, gum disease, or cavities. The combination of concentrated sugars and prolonged exposure to teeth can accelerate decay and worsen existing dental problems. For seniors with dentures or other dental appliances, the stickiness of dried fruits can also cause discomfort or difficulty in chewing. To mitigate these risks, rinse the mouth or brush teeth after consuming dried fruits. Opt for softer varieties like prunes or pear-dried fruits with crunchy foods, for example celery, to help dislodge residue from teeth. Number 8, grapefruit. Grapefruit is a nutrient-rich citrus fruit packed with vitamin C, potassium, and antioxidants, making it a popular choice for many. However, for seniors taking medications, grapefruit can pose serious health risks due to its ability to interfere with over 50 common drugs, including those prescribed for high blood pressure, cholesterol, and heart rhythm disorders. The primary culprit behind grapefruit's drug interactions is a compound called furanocoumarin, which inhibits the activity of enzymes in the liver and intestines responsible for metabolizing certain medications. Specifically, grapefruit blocks the enzyme cytochrome P450-3A4, CYP3A4, causing medications to remain in the bloodstream longer and reach higher than intended concentrations. This can lead to intensified side effects or toxic reactions. Unlike other citrus fruits such as oranges or lemons, grapefruit's interactions are unique and can persist for up to 3 days after consumption. Even small amounts, like a single glass of grapefruit juice, can trigger these effects. Seniors who enjoy grapefruit regularly may unknowingly increase their risk of adverse reactions when taking medications. Grapefruit interacts with a wide range of medications that are frequently prescribed to seniors. Statins, cholesterol-lowering drugs, medications like atorvastatin, Lipitor, and simvastatin, Zocor, are affected by grapefruit, leading to increased levels in the bloodstream. This can heighten the risk of side effects such as muscle pain or liver damage. Calcium channel blockers, blood pressure drugs, drugs like felodipine, Plendil, and nifedipine, Procardia, may reach dangerously high levels when combined with grapefruit, potentially causing low blood pressure or dizziness. Antiarrhythmics, heart rhythm drugs, medications such as amiodarone, cortisone, can be affected, increasing the risk of irregular heart rhythms. Immunosuppressants, drugs like cyclosporin, Sandimmune, used to prevent organ rejection in transplant patients, may become toxic when combined with grapefruit. Psychiatric medications, certain drugs like buspirone, Buspar, and diazepam, Valium, may have amplified sedative effects when taken alongside grapefruit. For seniors who often take multiple medications, polypharmacy, grapefruit's interactions can be particularly dangerous. Elevated drug levels may lead to severe side effects such as dizziness, excessive bleeding for blood thinners, or kidney damage. Additionally, many seniors already face age-related changes in metabolism that make them more vulnerable to these effects. Seniors who enjoy grapefruit should consult their healthcare provider or pharmacist about possible interactions with their medications. In many cases, alternative drugs that do not interact with grapefruit can be prescribed. For example, certain statins like pravastatin, Pravachol, or rosuvastatin, Crestor, are safer options. If avoiding grapefruit entirely is not feasible, seniors should separate its consumption from medication intake by at least 4 hours, though this does not guarantee safety due to the prolonged interaction window. Tips for seniors to enjoy fruit safely. Fruits are an essential part of a balanced diet, offering vital nutrients, fiber, and antioxidants that promote overall health. However, as seniors face unique dietary challenges, including slower metabolism, chronic conditions, and medication interactions, it's important to approach fruit consumption with care. Here are practical tips to help seniors enjoy fruit safely while maximizing their health benefits. Practice moderation. Instead of complete avoidance, while certain fruits may pose risks due to high sugar content or potential interactions with medications, complete avoidance is rarely necessary. Moderation is key. Seniors can still enjoy their favorite fruits in small portions without jeopardizing their health. For example, instead of eating a whole mango or banana, try half a serving paired with protein-rich foods like yogurt or nuts to balance blood sugar levels. Limit dried fruits like raisins or dates to a small handful, about 1/4 cup, to avoid excessive sugar intake. By practicing portion control and incorporating fruits into a balanced meal plan, seniors can enjoy the nutritional benefits without overloading on sugars or calories. 2. Consult a healthcare provider. About dietary restrictions, seniors often take multiple medications for chronic conditions such as diabetes, high blood pressure, or kidney disease. Some fruits like grapefruit or starfruit can interfere with these medications or worsen certain health conditions. It's essential for seniors to consult their healthcare provider or pharmacist before making significant changes to their fruit intake. For example, those on blood thinners like warfarin should avoid papaya and cranberries due to their potential to enhance the medication's effects. Individuals with kidney disease should limit potassium-rich fruits like bananas or watermelon to prevent hyperkalemia. Healthcare professionals can provide personalized advice on which fruits are safe and recommend specific serving sizes tailored to individual needs. 3. Opt for safer alternatives. For seniors who need to limit certain fruits due to sugar content, acidity, or medication interactions, there are plenty of safer alternatives that still provide essential nutrients. Low-sugar fruits, berries, for example, blueberries, strawberries, apples with the skin, and pears are excellent options for those managing blood sugar levels. These fruits are low in natural sugars and high in fiber, which helps regulate glucose absorption. Non-acidic fruits. For seniors with acid reflux or sensitive stomachs, non-acidic options like melons, for example, cantaloupe, honeydew, and bananas are gentler on the digestive system. Soft fruits. For those with dental issues or difficulty chewing, softer fruits like ripe peaches or canned fruit in water or natural juice can be easier to consume without compromising nutrition. 4. Wash and prepare fruits properly. Food safety is particularly important for seniors due to their increased susceptibility to foodborne illnesses. To minimize risks, wash all fresh fruits thoroughly under running water before eating to remove dirt and bacteria. Choose pasteurized fruit juices instead of unpasteurized ones to avoid harmful pathogens. Peel fruits when necessary, for example apples, if washing alone doesn't feel sufficient. 5. Incorporate fruits creatively into meals. Seniors who struggle with appetite loss or find it difficult to eat whole fruits can incorporate them into meals in creative ways. Blend fresh fruits into smoothies with yogurt for a nutrient-packed drink that's easy to consume. Add chopped berries or sliced bananas to oatmeal or cereal for a natural sweetness boost without added sugars. Use pured fruits as a topping for pancakes or toast instead of sugary syrups. Thank you for watching. If you're a senior or care for someone who is, we hope this video has empowered you to make informed choices about your diet. While fruits are a cornerstone of healthy eating, understanding their risks is key to protecting your health and longevity. If you found this information valuable, please share it with family or friends who might benefit. Together, we can spread awareness and support healthier aging. Don't forget to like, subscribe, and hit the bell icon for more health tips tailored to seniors. Until next time, take care of yourself and keep thriving.